A report has come out that this is the first case of HMPV in India, which is not true because HMPV is an existing virus and certain percentage of people do get affected by this virus, and it is not something new. And the baby, the child that has got affected, it has got no travel history, and they're all local people. They're not coming from China or Malaysia or some other country. So I do not think there's any connection to that. China's outbreak is, they are saying, is a new variant of HMPV. So that is what they are saying. We don't have the full details, and the government of India is yet to provide any full details to us. And maybe they are also trying to get more information. So if that could be a new strain of a HMPV which there is there in China. But HMPV is something which is already there it's been there for a long time, and it causes common symptoms like cold and for maybe flu and cough, and then it's a self-limiting virus, so it goes away after some time. And I don't think we should be calling it the first case. That is a wrong way of reporting. Because they are also looking at it and everybody is aware. I will not say they are also lax, because I think nobody wants to create some unnecessary storm and create panic. This is something which is a common existing virus, and it comes and goes. And what is happening in China is something that they are monitoring. And any future, we are also discussing. I've told our officers to have a word with ICMR and Government of India, and I'm having a meeting at 12:30 to see if any other new information has come, and for any further steps we have to take. I don't think we should be simply testing when, unnecessary. How many, for every person with cold and cough, if we start testing, then, what is the use of
to find out the strain of this?
But this is our own, these are all local strains which have been there. Whether China, we should also first know what is the strain that is there in China. That information has to come. So whether do they have it or not, I do not know. So let us see. I think maybe I can give you more clarity after the meeting gets over. And I will not want to blame anybody. But of course, we all have to be careful and take whatever necessary, which is there for all, any viral or any bacterial diseases. If we are careful, it's better for us. To wash our hands, to maintain some distance, especially if you have got symptoms. Those things are already, advisories have been issued. No, that I don't know. Let us not take any decision before coming to a proper conclusion. Of course, the PCR testing is always there for this, but whether that is needed or not is something to look at. Whether it is causing any serious, is it a serious public health concern? That has to be first of all decided. Is it really a public health concern? Just because one case has been detected, there are if you test anybody with some cold, they'll have some virus in them. If you test, I've got a slight cough right now, so I'll be having something. So that is another issue. But is it a public health concern or not? That is something we have to take a decision. Based upon that, then we can take further decisions. This is the first case in Karnataka because it has been there for the longest time. Certain percentage of people have this. Every time if you go into a detailed testing, in Baptist hospital, they've tested and they're private hospital. So we can't call it a first case at all anywhere in the country because it is already there. This may have been, they may have tested for this particular thing and it's been detected, that's all. But it's not that it's the first case.